afternoon, everyone. I'm delighted to welcome you all to today's webinar on understanding dementia. This session is designed to provide valuable insights into dementia care and how we can enhance the quality of life for those affected, especially as they age. Dementia affects an increasing number of seniors and their families, and understanding how to manage care effectively is crucial. Today's session will offer strategies, support mechanisms, and resources to help ensure that individuals living with dementia receive the best possible care. Before we begin, a few important points. If you have any questions during the webinar, please type them into the chat box. We will address them during the question and answer session at the end. For personal or specific queries, please feel free to contact Vayah Vikas on one-on-one support for further guidance. Additionally, we are offering a physical dementia screening at our Ekta Hub on Residency Road this Monday. Kindly keep your phone on mute. Now, it's my pleasure to introduce our esteemed speaker, Ms. Ramani Sundaram, Executive Director of Dementia India Alliance. With 14 years of experience in neuroscience, specializing in dementia care and elder care project management, Ms. Sundaram has played a key role in advancing dementia care in India. She has developed programs, conducted neuropsychiatric assessments, and led teams to improve the quality of life for individuals living with dementia. At Vayah Vikas, we are proud to collaborate with Dementia India Alliance in our shared mission to raise awareness and provide holistic support for seniors. This partnership allows us to combine our expertise and create impactful solutions for dementia care. Please join me in.
So, first of all, good evening, everyone. I'm Ramani. I'm a clinical neuroscientist and executive director at Dementia India Alliance. I would like to first of all thank Vayah Vikas for the opportunity and, of course, to all the senior citizens who have joined this program. Usually, a post-lunch session is very, very difficult to keep people engaged, but I hope that it is something you all enjoy. So today we are going to talk about dementia, and I'm sure that many of you must be aware of this term. So we work very closely for working with people with dementia, and this is a terminology which has become very famous in past few years. More Alzheimer's disease than dementia, which is known to senior citizens. And there is a reason why we are talking about dementia to all of you, because senior citizens are more prone to this condition compared to any other group. So today what we are going to talk about is what is dementia, why we should know about it. Is the main reason why we are having this session. Um, do any of you know about dementia, or do you have any personal experience? Do you have anybody in the family who's affected by the condition? If I would know whether if few people have the context accordingly, I can sort of talk about the condition. Is there a way that one or two of you could respond?
Could you please raise your hands in case you are, a primary caregiver or you know someone who is affected by dementia?
Okay, so basically, if you look at dementia, what we are trying to do in dementia is to bring help and hope for persons with dementia, and we are also trying to see how we can sort of prevent senior citizens from getting this condition. So if you talk about dementia, there's a very, very easy way of understanding this condition. We call it as dementia. So basically, if you break the term, it is degeneration of mental abilities. So we all have mental abilities, right? We have, for example, memory or thinking or calculation or personality. All of it, we need this to work together for us to be efficient in our day-to-day life. What dementia does is affects all these components of our daily living. So whenever we talk about dementia, it is very difficult when we are talking to senior citizens, because many signs of dementia look very much like what you experience in old age. And that is the reason diagnosis of dementia is very, very poor. So if you look at dementia, it's an umbrella term. We basically, whenever we talk about it, people say dementia is a memory loss. So that is the first sign of dementia. People tend to forget. But how bad is the forgetfulness? It is as bad as the person is not able to remember things like how to use a remote, how to drive a car, things that they were doing earlier, how to do cooking, if it's a woman who has been cooking in the kitchen for a longer amount of time, or how to use the bathroom, how to come back home. So these are things they tend to forget, and it is not a part of normal aging. And why we need to talk about dementia is because there is no cure at present. That is the reason we are talking about this condition, and it affects the brain. Many times, what happens when somebody has diabetes or hypertension, they visibly look sick. So, when they visibly look sick, people can understand the situation, they have empathy towards it. But when we talk about person with dementia, the changes are happening in the brain, and the person can behave in a certain manner because of that, due to which people are not able to understand that they have a sickness, and they're not very empathetic towards this condition. So that's the reason we need to have more awareness about dementia. So today, right now, we will be talking about the 10 warning signs of dementia. This is something very, very important that senior citizens should be aware of, because these warning signs, if it is there with you, your spouse, or your friend, then there is a need for you to get a screening done or to approach for help. So when you look at warning signs, the first is, of course, memory loss. When we talk about memory loss, you all may ask, I also forget. I forget my key. I forget the names of my friends. I forget where I've kept my mobile. We are not talking about this kind of memory loss. We are talking about a memory loss wherein you forget what you had for breakfast. We are talking about a memory loss where you forget where your house is. If you go to buy a packet of milk, you don't know how to come back to your house. That kind of memory loss. Or you are asking the same question again and again in a very, very small frequency. Then these are the warning signs that we talk about when we say memory loss, which is due to dementia. And many times what happens is, if you have a memory loss due to normal aging, if you forget something, after some time you recollect. But for persons with dementia, if this memory loss is so bad, they were not able to remember where they have kept their things earlier. There's no recollection at all. So that is very, very important. Then they have difficulty in performing familiar tasks. As I suggested, you may have memory loss, but it will not be that bad that you don't know how to ride a scooter, or how to drive a car, or how to use a remote, or how to cook. These are things usually senior citizens, even with memory loss, don't forget. But if a person has dementia, these are things that they tend to forget. Then they will have problems with language. They will not know what is the right word to say. They may say, oh, I want this, but they are not able to name that particular thing. Or when they are talking to somebody, they are not able to form proper sentences. So that is also one of the warning signs. And they will have disorientation to time and place, in the sense they may have difficulty in saying whether it's some confusion with morning, afternoon. And disorientation, getting lost, is another way. You're not able to find your way in familiar surrounding. That is also something that people with dementia have. And they have poor judgment, in the sense difficulty with managing their finance, difficulty in deciding what is right, what is wrong. All of that issues they will have problems in keeping track of things. Today morning I have to go for this appointment, then I have to come back and look into bank issues. So if you have something that needs to be done throughout the day, if there is a memory loss which is due to dementia, then they have very tough time in keeping track of things. And they may also misplace things. They would not know where they have kept their things. This is something even we may have, right? We may keep our mobile phone somewhere and we may forget. But actually, if you think really hard, you will know, okay, where all did I go in last 1 hour? You tend to search in those places so that you can see whether you have left your things there. But for a person with dementia or a memory loss that is due to dementia, people are not able to navigate where they were in past 2-3 hours to find that particular object. So it's very tough for them. And they will also have change in mood and behavior, because if you're forgetting and somebody says, hey, you're forgetting, you're asking the same question again and again, people tend to get very irritable. So that is also there. And they don't like to socialize because they are forgetting. People are picking up that they are forgetting. They don't tend to socialize, they keep to themselves. So these are few warning signs of dementia, and if it is there, it is necessary that people go and take help. And as I was suggesting, many times dementia is assumed to be part of normal aging. And that is the reason we are not able to diagnose dementia in time. Why? Because even in normal aging, we have memory loss, right? But in dementia, the memory loss becomes worse as the time goes. But when people have memory loss due to normal aging, usually it does not get worse. Also, when they have a memory loss in normal aging, they are still able to live independently, they are able to do their work independently. But a person with dementia related memory loss will not be able to do things independently. So that is also very important, and it will not affect their day to day activity. If normal aging person has a memory loss, it won't affect their day to day activity, but for a person with dementia, it affects their day to day activity. There's a very simple example that we usually give to people to understand what is normal age related memory loss versus what is a dementia related memory loss. Say, for example, I call one of you and I say that, tomorrow I'm coming to your house for lunch. I call you and I say, and you tell me, okay, fine, I will, send a car to pick you up. Okay. Say next day you were supposed to send a car, but car has not come. When I call you and ask why no car has come, you tell me, oh, I forgot, let me send a car. That is just age related memory loss. But if it's a dementia related memory loss, if I call you and ask why there is a no car, you may just say that I don't remember you calling me at all. So they tend to forget the entire incident rather than a part of the incident. So that's the difference between aging and dementia related memory loss. There are different types of dementia. I'm not going to go very deep into it, but currently if you look at newspapers or if you look at internet, the most common type of dementia which is being spoken everywhere is Alzheimer's disease, because that is something which is worldwide known to be highly prevalent. It's just a type of dementia. For us, whichever type of dementia it is, it doesn't matter because there's no cure, and the course of progression is very similar. People forget their nearby relatives, then they forget whatever they've learned throughout their life, whether it is going to the toilet, whether it is using language, whether it is looking after themselves, whether it is eating, drinking, everything they tend to forget as dementia progresses in any of these dementias. But Alzheimer's is known to be the most common type of dementia. But in India, vascular dementia is higher. When we say vascular dementia, that means it is related due to vascular risk factors like diabetes, hypertension, cardiac issues. Many of you are senior citizens, and you will all know that many of you may have one or two conditions, right? Because it's so common. Vascular dementia is very common because when you have a long standing diabetes, long standing hypertension or cholesterol, there are changes that happens in the brain which may lead to dementia later. So we need to be careful about our vascular factors. So usually, how do we diagnose dementia? It is very, very difficult to diagnose dementia because as I said, when a senior citizen has a memory loss, most of the time it is just looked at as part of normal aging. So people don't really come to a doctor for a memory loss. It's very rare that people come. People usually come to a doctor only when the memory loss is really worse. For example, person has gone into the bathroom to take bath but just comes out without bathing, then the family notices that something is really wrong. Or the person has gone to purchase milk and they never came back home because they forgot their route. That is when the family comes to a doctor. But when they have initial memory loss, they are forgetting, the family can notice it, they will never take their parents, or the senior citizens will not come directly for a screening. But when it's a physical issue, for example a fever or a stomach ache or any other medical condition, senior citizens or family is more proactive in seeking help when it's a physical condition. But when it's a psychiatric condition, people are not very proactive to seek help. And that is the kind of awareness that we are trying to spread, that whether it is physical health or it is cognitive health, It is equally important. Your brain health is also equally important. So if you have a memory loss, it is important that you go and seek help. If you're forgetting names, you're forgetting places, you're forgetting words, it's important that you go and get yourself screened. And usually for diagnosis, if you see in dementia, we don't go invasive at all. There's no big invasive procedures that we do. Usually we collect a detailed history. What is it that the person is forgetting? We may ask to do some blood tests because many of the symptoms are treatable. For example, if a person have a vitamin B12 deficiency, many times people can have memory loss, which can be corrected. If they have electrolyte imbalance, people can have confusion that can lead to memory loss, which then can be corrected. So there are so many things that one can correct. And I'm sure that most of you will be doing an annual blood checkup. Some of you may be even doing half yearly if you have diabetes and hypertension and cholesterol. So when you do a half yearly blood test regularly to keep a check on your blood parameters, just like that, what we are trying to say is, as you go for yearly blood test just to ensure everything is okay with your body, you go for a yearly cognitive screening. You yearly memory screening, if you go, you can also keep a check on your brain health. And when we do memory screening, there is no invasive procedure, there is no blood that is drawn, or there's nothing like that. We just ask some simple questions, like related to memory, related to language, related to calculation, and we may say whether your cognitive performance is good. If it is good, you just come back after 6 months. If it is not good, we try to do a detailed assessment and see if we need to intervene early. Because though there is no treatment for dementia, if it is something that is diagnosed really early, people can have a very good quality of life, at least for 5 to 6 years, which is very important. They can plan well, they can plan for their family. All these are very important. So basically, if you see different stages of dementia, the first one is mild cognitive impairment. This is something where we would ideally want to, screen people. We would want to pick up people in this particular stage. So basically, they will have issues in their memory, language, calculation, which is noticeable. Either they will notice or their family members will notice. Here, there are about 80 senior citizens. I'm sure that many of you would, at some time, would have thought, I've gone to the fridge to take something and I've just forgotten what it is. Then you come back to the kitchen and then all of a sudden you realize and you go back to the fridge and take something. Now, these are small memory lapses. If they are happening very frequently, it is important that you get yourself screened, because at this particular stage people are able to live independently. The whatever memory loss is there, it doesn't really affect their activity of daily living, so people don't go to a doctor. And this is the stage where we say, just like a blood test, since this is completely non-invasive, you get a screening done. Because if you come for screening and we identify you are at risk, there are so many risk reduction tips that we can give you, which will help you to not to progress to dementia. Because about 40% of dementia cases can be reversed if the risk factors are maintained well. If you look at different stages of dementia, there's usually, the first is the mild stage. In mild stage, people become really forgetful. They have difficulty in communication. If you ask them the date, time, they may not be able to tell it very clearly. If it's a woman, who have been cooking in the house, they may put extra salt, or they may not put salt, or they may forget to switch off the gas. These are things that they may start doing. If it is men, then there's a possibility they leave their door key on the door itself, or they leave their wallet in a public space and not remember that they've left it at all. So, these are things that we should be mindful about. And this is the stage when people also try to be very, very suspicious. So if something is lost, rather than thinking that they have misplaced it, they tend to say the maid has taken or somebody else has taken. So these are the warning signs of mild stages of dementia. If people come for treatment, even in mild stages, there are so many things that can be done. But it is unfortunate that people don't come at that stage of diagnosis. They usually don't come to a doctor or to a memory clinic. They never come. So if you look at moderate stages of dementia, people become really, really forgetful. They forget their near and dear ones. They may have difficulty recognizing their wife. They may have difficulty recognizing the children, grandchildren. They will have very much difficulty in following a drama on a TV. They may have difficulty keeping up with newspaper reading. They may also need help with personal care. For example, they may wet themselves once or twice because they don't know where the toilet is, or they can't feel the sensation. They may not be able to go out for shopping on their own. These are things that may happen. Or getting lost is a very, very big problem that happens in the moderate stages of dementia. And since they don't have a lot of memory, there can be difficult behaviors as well. So when we talk about difficult behaviors, they may assume things. They may not be interested in participating in activity. They may just make up different things. Somebody came, they stole something which may not be true, or they may see things which are not there. They may get angry for no reason, and or they are very depressed, but there's nothing really that they need to cry about. They may think about very, very old memories and be very sad about it. So these are different things that happen, and these are things that are very, very challenging for the family members to handle and take care of the elderly person. Think like in our experience, we have seen people where husband and wife, they are talking to each other. The husband cannot recognize the wife anymore, and he asks to his own wife to find his wife, you know. Like, because for him, his wife might be younger or looks different. He's unable to recognize his own wife and asks for her help to find his near and dear one. So it's a very, very tough situation, not just for person who is suffering with the condition, but also people who are taking care of them. And in severe stages of dementia, people usually forget how to walk. They forget how to swallow. So when they forget how to swallow, it's a very, very difficult point where we have to take care of people with dementia, because when they forget to swallow, you have to put tubes through which they have to eat food, and they are no longer able to remember what's going on with them. And most of the time they are bedridden. They are confined to a wheelchair, or they are completely in the bed. They are not able to talk. They are not able to respond. So, and they can remain in a severe stage for years together. So that's the reason we vouch for people coming early for diagnosis, because much of it we can prevent. So when we talk about dementia, you must be thinking, there are so many conditions that people can talk about, whether it is cardiac condition, there is diabetes, there is hypertension. Why are we talking about dementia? Is it so important? If you look at diabetes or hypertension, which requires lifelong treatment, it doesn't really take dignity away from the person. But in dementia, the quality of life and dignity is taken away from the person. All of you would like to be independent as long as you live. Think about a life where you are no longer to do your own things like dressing, eating, drinking. If you are unable to do, and someone else has to do it for you, and you don't know who's that person, it's a very, very tough life to live. That's the reason we talk about looking after persons with dementia with utmost care and dignity, because they by themselves cannot decide for what is happening in their life. For example, if there is a person with dementia who's hungry, many times they're not able to communicate that they are hungry because they have difficulty in expressing, or they have difficulty in using the language. So if they are hungry and somebody puts two idli in their plate, we don't even know whether it is enough for them, because they are unable to ask, or they may overeat. So there are so many things that actually takes away the quality of life of person with dementia. So it's very, very important that we know about this condition to preserve the quality of life. And people have no sense of identity. People would have been educated for so long, but now there'll be difficulty in reading ABCD. So they find it very, very tough. They would tell us that they are maybe retired judge or retired collector who's now having so much difficulty in reading and writing, in understanding a book. There's so many challenges. A woman who has managed the household so easily can't even recognize vegetables. So these are things that can happen to them, and they will look for somebody to help them with putting on their clothes, giving them a bath, taking them to a toilet. It is nearly like going back to the early days of life. But the person, when they go back to the early days of life, at least child doesn't know what is happening to them. But this elderly person who's suffering with dementia most of the time knows what is happening to them. And that's the reason it is heartbreaking, not just for the family, but also for the person who's undergoing this condition, right? So when someone has dementia, what actually is the impact? that happens on the person. There's, of course, reduced cognition. People don't remember, they're not able to concentrate on things, they're not able to communicate properly, they're not able to do their activities of daily living independently, they have so much confusion. And of course, when they are in the moderate stages of dementia, they don't know how to walk, they may have frequent falls, they may not know how to swallow their food. So, that sort of decline happens. And many times they also become bedbound and they're not able to communicate. We really don't know if the person is, having pain because they're not able to express. So it's a very, very tough um stage to be in. When they are in severe stages of dementia, they may have a lot of emotional problem. For example, one of a senior citizen whom we are caring for, person with dementia, he came and said there is a snake in his room. When we go into the room, there is no snake. He's just assuming that there is a snake, though we know that there is no snake. For him, it's a reality. He's petrified. So people undergo so much emotions which perhaps arise out of situation which is not true, but then it is so true for them that they undergo a lot of pain, fear, anxiety, depression. There are so many things they may assume. They may say, my wife is dead, somebody has killed them. Though you try to reassure, they don't remember. And it's very, very tough for them to deal with the emotion. And there's loss of interpersonal relationship, right? Because if people have grown old together, they would have made so many promises to their spouse that after I retire, we both will enjoy our life, we'll go here, we'll go there. But when a person gets dementia, they're even unable to recognize their own spouse with whom they have lived for 50 years, 60 years, children whom they have loved so much, grandkids for whom they have so much expectation. They don't remember anybody, and the person with dementia feels all alone in spite of having all of the family around. And also for the family, the person who's there no longer recognizes them. There might be change in personality, they may not relate to the person anymore. So it's a very, very challenging situation, not just for the person but also for the family. And if you look at the family, they have to deal with so much of emotions, because if I am looking after somebody with dementia with so much love and they don't recognize me, they in turn are very angry with me for giving them all the support, then it's a very sort of a tough way to keep going on and caring for the person. That's why in dementia we say that caring for somebody with dementia is a thankless job, because they really don't understand that the caregiver is doing so much for them, because they don't recognize the person. And it is not just like one day, it's every day. So today if I go and tell, I'm Ramani, I'm going to look after you, they may remember. In an hour's time they're going to go forget. So you have to keep on telling them who's the person who's caring for them. And sometimes they may look at the person with so much suspicion. And we have had cases where the daughter might be looking after a father with dementia. She may have no help. She must be the only earning member of the family. If father has dementia, he doesn't know the difference between what is eatable, what is not eatable, how to use the toilet. If she has to go for work, if there's nobody to look after him at home, we have seen cases where people have tied um, people to they have tied people to a rope, and they have managed the person, because they don't have anybody to look after them at home. And look, getting a trained caregiver to look after somebody at home is very expensive. You all must be aware of that. And if it's a senior citizen who has to look after their own spouse, it's a physically challenging caregiving job. And many times families undergo a lot of stress in looking after a person with dementia, because they do so many things that they are unable to explain to people in the community. The person whom you're looking after can go to the opposite house and say, my daughter is beating me, which may not be true. And in spite of all that, with all love, you have to look after the person with dementia. There are many, many people who have lost their own personal life because they have to just care for the person. They don't have time for friends, they don't have time for their own life. It's very, very difficult situation. And people with dementia live anywhere between 2 to 10 years. So the person who's caring for them also has to live 2 to 10 years without really having their own personal life. So it's a very, very tough place to be in. I'm going to pause for a minute before I go any further. If there's any question, any doubts that you would like me to address. Joyce, you're there? Or Ashwini?
Yes. So we do have a couple of questions which are there in the chat box, Ramani. Maybe we could address them. The first question says, typically at what age one gets affected by dementia?
Right. So currently, we say that anyone above the age of 55 is at the risk of developing dementia. And more the awareness, people are getting diagnosed earlier, but above 55 is maybe a safe age to say.
All right. So we said 55. The next question is, who does it affect? Does it affect the men or the women? Who does it affect more?
So dementia in that way doesn't see difference between gender. So it's equally affects both the gender, but current statistics and research says more women than men. The reason being women live longer. So, that might be the reason why we have a little more of women than men. But there are no such substantial differences on who gets affected based on gender.
Could it be, there's another question that talks about the actor in Gajani. Is it something very similar to that? And are there any vitamins or sunlight? What helps? Is the next question.
So, if you look at risk factors for dementia, there are many. And I'm going to cover it in a couple of slides now. So basically, when we talk about dementia risk factors, there's diabetes, there's hypertension. There's also now research on vitamin B12 and D3 deficiency. So if one can correct all that, treatable causes of dementias can be managed.
I think the rest are all about risk factors and are they, any preventive measures and so on, which I'm sure you would be covering in the first.
Yeah, absolutely. So I'll carry on with that. Thanks, Joyce.
Sure.
The next is about why we need to talk about dementia. The first and foremost important thing is that there are at present 88 lakh people with dementia in India, and in India we say there is a 7.4% prevalence. That means if there are 100 people above the age of 55, in that there is highly likelihood that 8 of them are going to have dementia, and that is the reason we need to talk about it, because earlier we were a young country, but in 10-15 years from now we are going to be a country with a lot of old people, and this is a problem which is going to affect at least 8 people in a group of 100. So we're going to have more and more people with dementia in the future. So it's important that we need to talk about it. And the second thing is that 90% of people never get a diagnosis. As I suggested, since the signs and symptoms are very similar to memory loss due to normal aging, people do not proactively come seeking a diagnosis. So 90%, almost 90% never get a diagnosis. And it is said that in 2036, there'll be more than 1 crore of people with dementia with this condition. And the cost of care for dementia, for example, if you have diabetes, you go to the hospital, you get a pill, you manage it. But in dementia, the cost of care comes from somebody leaving their job, sitting at home to look after their loved one with dementia, or you have to engage a home care personnel to look after somebody with dementia. These are things that are not covered in insurance. So it's mostly an out of pocket expenses, buying a diaper for an elderly and things. So the cost of dementia care is very high. And if you look at the challenges that are there in the field of dementia, if you see, there's a lot of lack of awareness, and there's a lot of stigma. Currently there are 85 of you. If I ask you how many of you have done yearly blood test, I'm sure that 90% of you would say we have done it. But if I ask in 85 of you, how many of you have gone for a cognitive screening, there is a likelihood that I may not even get a 10% yes. So there is not the same level of importance that we give to brain health. So there is a low rate of diagnosis. And since we say that there is no cure for dementia, many times people say, why should I know? If there is no cure, why I need to know? The reason why you need to know is if we diagnose dementia early, people can remain independent for about 5 to 6 years. And when you are able to remain independent for 5 to 6 years, there are so many key decisions that people can make for themselves, for their family, about their property, about their money. There's so many things that people can plan better, and people can have a better quality of life. So that is also another challenge that we face, that people don't want to know about the condition. And there are not a lot of services that are available for persons with dementia. We run a helpline for dementia. We get calls from northern regions of the country where people say, I have somebody at home who has dementia, but we are not able to refer them to any care services because they are very, very few in India. And also, the number of psychiatrists, neurologists, or geriatricians are very low. And I'm sure that many of you, for any other ailments or for somebody at home, you would have taken home care services, and you all might have had an experience that these people are not trained very well. Now, for looking after somebody who's healthy or maybe a little sick, itself training is not enough. To look after somebody with dementia requires a lot more training and patience, which is not there in the current lot of people who are providing home care. And also, when a person has dementia, they are not able to communicate what is happening to them. There is a high chance of abuse, and they cannot report also. So it's very important that we know about this issue, so that if people are behaving in a certain way, children don't think it is because they want to behave in a certain way. Sometimes people with dementia can be very mean, and these are things they are saying without really meaning it. It's not in their control. So in spite of not knowing that, people can abuse, whether verbal or physical. So these are things that can be prevented if people have a lot of knowledge. And there is also a high chances of abandonment, especially in lower middle class or poor people. When someone gets dementia, they just leave them, they just abandon them. And we when we are running destitute homes, we pick up so many people like that who have forgotten their family, and the family have just left them on the road. So that can also happen. And there's a lot of people who go missing, and that is very, very difficult to find, because these people cannot say that where their home is, and how they have to find their way back. They really don't know. So it is important that we have a lot of awareness and education, and we are able to have a care strategy where we are able to do risk reduction and prevention as well. And that's what Dementia India Alliance wants to do, because this is something which is preventable. About 40% of it at least is preventable. And when you diagnose someone early, you can do a lot for them. So that's where we come in. So we are a national organization, and we work for the cause of the elderly and the cause of dementia. So we are a society, a not-for-profit, and our only purpose is to bring help and hope for persons with dementia and their family caregivers. Since we have to identify persons with dementia, that means we need to ensure that our senior citizens are healthy. So our beneficiary base is mostly senior citizens, because we want them to know about this condition. We want them to look after their health, because we don't want to see more and more people with dementia, because we know how difficult it is. So if you look at the risk factors for dementia, it is cholesterol, you know there is vision issues. So if you have a vision problem, you get it tested, you get it corrected, it seems to have a very good impact on your cognition. So these are things that can be done very easily. And of course, education is also something that we say is a risk factor. If you're educated well, then the risk for dementia comes down. But that is of course not something that we can intervene at this stage of life. But then somebody who's learning different languages, who's multilingual, it seems to be protected from dementia, compared to someone who speaks only one language. So that is something that we usually tell senior citizens to do, that is to learn one new language, learn a new skill. That is very important. Social isolation is a big risk for dementia. So meeting friends, having a good group of friends, going out, meeting people, that is also seem to be very protective for persons, for preventing yourselves from dementia. Air pollution, nothing, not much in our hand, but then that's also a risk factor for dementia. Traumatic brain injury, which can be easily prevented. So if you're traveling outside in a bike, even if you're sitting behind, you have to wear a helmet. That's the reason why they say that the pillion also needs to wear a helmet. If you're driving in a car, wear your seat belts. These are things that can be preventable, because when you have injury to your head, it can cause injury to the brain. And when there is injury to the brain, it can increase the risk for dementia. And senior citizens are prone to falls as well. So that's the reason we say you need to develop good strengthening exercise so that you don't fall, because if you fall and hit your head again, that is also something that can promote the risk for dementia. The most important risk factor that has been added right now is hearing loss. Many senior citizens are they have some sort of a stigma to go for a hearing test and use a hearing aid, but there is a proven research that if you correct your hearing, the cognitive decline, a lot of it can be prevented, even reversed. So it is important that people get hearing screening done. And if you have any hearing loss, get it corrected. You have to look after your blood pressure, you have to look after your sugars, you have to look after your, if at all you are obese, you need to look at that as well. Physical inactivity, if you're not doing your exercise, whatever is not good for your heart is not good for your brain. So that is important that we look at physical activity. And we should reduce smoking, so we should completely avoid, and we should reduce alcohol consumption. So these are all listed risk factors in research, which if somebody works on, you can prevent dementia. Depression is another thing, because in senior citizens, many times depression is very silent, it never gets diagnosed. Say for example, somebody has been working till the age of 60. When they get retired, they really don't know what to do with their life, and they become very quiet. So the family thinks, okay, because after retirement he has become like that. But it is essential to find out if the person is depressed, because if they are depressed, long term depression can lead to dementia, it can lead to irreversible cognitive decline. And depression is something that is manageable, that is treatable. So these are all causes, those are treatable. And if we keep a check on most of them, there is a high possibility that 45% of the cases can be prevented. So how do you prevent dementia? Though there is no guarantee that, if you do all this, your risk, you're going to cutting, you're not going to get dementia, but you can cut down your risk. It is very much there. So staying physically active, we recommend at least 30 minutes of exercise 4 times a week, which is 120 minutes. And it could be walking, it could be, it could be yoga, it could be doing some strengthening exercises, some stretching. You can do a lot of mix and match of exercises, but it's all about getting that 120 minutes of exercise every week. It's very important. So that is something that can be done. And if you're somebody who's obese, who says, we have heard a lot of senior citizens says that, I have a knee issue, so if I walk, my knees pain. So if you have a condition like that, it's perfectly okay, you can sit in a chair and you can do chair walking. There are so many YouTube videos, we can share the link. You can sit on a chair and you can do walking that burns the same level of calories that you will burn by walking. And I'm sure that many of you must be doing yoga. That's also a wonderful way of keeping yourself active. So get that 120 minutes of exercise in a week. Then eat healthy. Maintaining a healthy diet is very important, because for example, vitamin D3 or vitamin B12, these are nutrition that we can get from food. So eating a healthy diet is very important. Getting, your vegetables, nuts, that's very important. You should reduce alcohol consumption. Smoking, definitely people should not do at all, because it's a risk factor not just for cancer, lung disease, but also for dementia. Keeping the brain active, I think we give a lot of importance to keep our physical health in good shape, but we give very, very less importance to brain health. So there, doing some sudoku, reading a book, learning a new language, these are things that you can do, and you can do it with your friends. That's also something that you can enjoy, doing some memory activity, doing some language activities. These are things that you can do. If you see Nightingale's Medical Trust, which is very, very active in aged care, runs a program called Active Aging, wherein they provide 120 minutes of physical activity and 120 minutes of cognitive activity, brain activity, and they do it in a group, and it's so enjoyable, and it can reduce the risk of dementia to a large extent. We are all social beings. That means we are supposed to be social, we are supposed to talk to people, meet people. So stay socially engaged. I'm sure many of you must be going to church, must be going to temple. If these are things you are doing, keep doing it, because going for a morning walk alone versus going for a morning walk with your friend is highly beneficial. The second is more beneficial. So we should try to make more friends, do things in group, because that seems to have a lot of positive effect on the brain. We should manage our health condition like diabetes, hypertension. If you're taking medication, ensure that everything is in check and you're getting it regularly checked. Manage mental health. As I said, depression. If you feel your depression, talk to somebody, get help. If you feel teary, you feel alone, you feel your life, sometimes feeling worthless, these are things that you need to discuss with somebody. And there is no shame in discussing about mental health, because that can also reduce the risk of dementia. Sleeping is very important. You need to give at least 8 hours of rest to your brain. I'm sure many of you may have sleeping issues, but then there are sleep hygiene protocol that if we follow, sleep can be very much regulated. And most important, protect the head. Try not to get head injuries. So that is very important. So what is the message that we are trying to leave you with? There is, just like how you get a yearly blood test done, please get a yearly memory screening done. You can get it done online, you can get it done offline, you can get it done at Vayah Vikas office as well. They've been very kind. We have trained few of their people. It is just going to take a 15-20 minutes where certain questions are being asked, and we try to see whether your memory is okay, your language is okay, and we try to see how we can help you so that you don't get dementia. At least you can prevent, you can reduce the risk of getting dementia. And even if you diagnose early, there's so much more that we can do. So there's a lot of hope when you actually diagnose somebody early. So the message that I'm going to leave you with is, there are 85 people on this call. If all of you can please get yourself screened, that will be a big help, just not to us but to yourself, because we can look at your brain health, we can tell you how you are doing. And if you don't have any problem, you have to just get it done after 6 months, and all you need is those 15 minutes of time that you need to give us. That's a request that I'm going to leave you with. And we have an online platform called Dem Clinic, where memory clinic can be done online. All of you are very tech savvy, you're attending a webinar. So if you don't want to go to a place to get yourself screened, just we can do the screening online, and it is completely free. So please, I would suggest all of you to look at getting a memory screening done online. And if you want to do it online, you can go to Dem Clinic. We'll be happy to do the memory screening online, and we can do it in your own local language, in English. All those services are available. If you have any doubts about what we have spoken today, because I'm sure it might be quite a bit for all of you to absorb. So if you have any doubts after that, there's a free helpline that we run. That's 8585990990. You can call at that helpline. We can give you all the guidance about memory loss, risk reduction. You can know about it. You can even book a memory screening through this number, and we will be able to help you. We do a lot of awareness program on dementia. If any of you are staying in an apartment, your children go to colleges, you can let them know that we are here to talk about dementia. We go and tell about this because it's important way of spreading awareness. Today I have told 80 of you, you will speak to 100 people, and that's the only way that dementia awareness will spread. Diabetes, hypertension, cardiac condition, they're so easy to spread awareness about it, but for a condition like dementia, we need all your help. So please help us out. If you have an apartment complex where there are lot of senior citizens, we'll be happy to come down, do a talk, do a screening there itself, so that people can know about this condition. And we do a lot of training programs for people who are undergoing this condition. If their family caregivers are looking after them, we do training for them on how to look after the person with dementia better. You can look at our website for what are the other services that we provide. And we do a lot of advocacy with the government. I'm not sure if you have seen it in the newspaper. In 2023, Karnataka government has announced dementia as a public health priority. Just like how I am telling you about screening, Karnataka government now in every PHC is doing screening for dementia to identify dementia early. So that's the request that I'm going to leave you with, that spreading awareness is so important. We have done it. Now it's your opportunity to, get yourself screened, and it will be a big help that you will do for us. And it will be a big help that you will do for yourself. So I urge all of you to kindly get yourself screened, get your spouse screened. If you have friends in that age group, please tell them to get themselves screened. It's just a 15-20 minutes thing, and that's going to help you a lot. So thank you for the opportunity. If there are any other questions, I'll be.
Thank you, Ramani ma'am.
Sure, no problem.
As we wrap up today's insightful webinar on understanding dementia, I would like to extend my sincere thanks to our speaker, Ms. Ramani Sundaram, for sharing her insights and knowledge. Your expertise has been incredible, inspiring, and helpful. A big thank you as well to our participants for your active engagement and thoughtful questions. Before you go, please take a moment to fill out the poll for today's session. For further assistance, don't hesitate to reach out to Vayah Vikas at 951 33 00821. Thank you once again and have a wonderful evening.